Ayahuasca is often described with reverence as an ancient, sacred medicine capable of unlocking deep emotional truths, offering spiritual clarity, and even transforming the course of a person's life. For those struggling with addiction, this promise can be seductive. Conventional treatment often feels insufficient, or it simply fails altogether. The revolving door of relapse, therapy, and medication leaves many feeling hopeless. When a mysterious jungle brew is said to offer not just healing but self-understanding and peace, it can seem like a lifeline. But beneath the spiritual mystique and anecdotal success stories lies a much more complex and potentially hazardous picture, one that must be confronted with clarity, skepticism, and caution. The idea that ayahuasca could help treat addiction is rooted in its ability to alter consciousness and provoke intense emotional experiences. It contains DMT, a powerful psychedelic that temporarily changes the brain's neurochemical environment, particularly by acting on serotonin receptors. This results in visual hallucinations, powerful emotional surges, and in some cases, what people describe as mystical or ego-dissolving experiences. While these effects can feel profound, they are also inherently unpredictable. Emotional breakthroughs can quickly spiral into psychological breakdowns. Vomiting, diarrhea, panic attacks, dissociation, and terrifying hallucinations are common side effects, not outliers. For people already in a fragile mental state due to addiction, these risks are not theoretical. Ayahuasca has the potential to exacerbate psychological instability rather than alleviate it. Its use has been linked to episodes of psychosis, manic behavior, and in rare cases, long-term psychological damage. What's more, the very intensity that makes the experience seem valuable is also what makes it dangerous. Facing buried trauma and unresolved pain can lead to emotional flooding, dissociation, and re-traumatization, especially if the ceremony is not led by qualified mental health professionals trained in trauma-informed care. Too often, those leading ayahuasca sessions in westernized settings lack this training. Beyond the psychological risks, there are significant physical dangers. Ayahuasca can interact dangerously with a wide range of medications, particularly those that affect the brain's serotonin system. Combining it with common antidepressants such as SSRIs can lead to serotonin syndrome, a potentially fatal condition. Even without pharmaceutical interaction, the brew can cause spikes in blood pressure and heart rate that pose real risks to people with underlying cardiovascular conditions. Despite its traditional use in indigenous communities, where it is administered under culturally grounded protocols, in modern Western retreat centers or underground gatherings, safety protocols are uneven at best. Some ceremonies are conducted in remote locations without access to medical care. In these environments, a bad reaction can quickly turn into a medical emergency. Legal and ethical concerns further complicate ayahuasca's role as a therapeutic tool. It remains a Schedule I substance in the United States, meaning it is considered to have no accepted medical use and a high potential for abuse. While some religious groups have won court cases for its legal use in ceremonial contexts, the broader legal landscape remains murky. Traveling to countries like Peru or Brazil, where the substance is legal in certain settings, does not guarantee safety. These ayahuasca tourism industries have become profit-driven in many cases, and reports of abuse, exploitation, and poorly managed ceremonies are increasing. Vulnerable individuals, especially those desperate to overcome addiction, are often manipulated into believing that ayahuasca is their last hope. It's also important to question the seductive narrative that ayahuasca provides a shortcut to healing, a single, cathartic experience that breaks the chains of addiction. Addiction is not a one-dimensional problem. It is a complex, chronic condition influenced by biology, environment, trauma, mental health, and social dynamics. One psychedelic trip, no matter how emotionally intense, cannot unwind these layers. In fact, treating ayahuasca as a silver bullet can distract people from doing the long, often uncomfortable work of building recovery through established, evidence-based methods like cognitive behavioral therapy, group support, and medical care. When ayahuasca ceremonies are marketed as transformative cures, they risk feeding the same impulsive thinking that fuels addictive behavior in the first place. The science behind ayahuasca's effectiveness in addiction treatment is still in its infancy. Many of the studies cited in support of its use are small, lack control groups, and rely heavily on self-reported outcomes. There are no large-scale, randomized clinical trials that demonstrate lasting efficacy. The improvements seen after ayahuasca ceremonies could be due to placebo effects, the power of group dynamics, or simply the passage of time. Without more rigorous data, recommending ayahuasca as a legitimate treatment for addiction is premature and potentially irresponsible. It's tempting to look at ayahuasca through the lens of hope. And for a few individuals, under the right circumstances, with adequate screening and follow-up care, it might indeed offer a moment of clarity or emotional release that contributes to recovery. But for many others, it is a high-risk gamble cloaked in spiritual language. It is not regulated, it is not well understood, and it is certainly not benign. Framing it as a therapeutic miracle not only distorts the truth, but also endangers those who are most in need of careful, grounded treatment. If society is to explore the therapeutic potential of substances like ayahuasca, it must do so slowly, cautiously, and within rigorous clinical frameworks. The stakes are too high to rely on testimonials and magical thinking. Addiction takes lives. We cannot afford to romanticize a hallucinogenic tea as a panacea when the truth is far more complicated and far more dangerous.